exactly did Congress do last night?
Well, it was a late night and into the early morning here in the Senate, where Republicans were able to lay the groundwork for repealing the Affordable Care Act, otherwise known as Obamacare. What they did was enable to attach a budget resolution, the groundwork that later on will allow them to dismantle this law. Now, of course, it comes with several key questions about whether or not they have an alternative plan to implement once they do actually dismantle this law. And it also raises questions amongst moderate Republicans as well as more Republicans who have concerns about this and are up for re-election about whether or not they will be able to keep portions of this law and dismantle it without adding a new version.
Kevin, you spoke to the Trump camp earlier today about the Obamacare, of course, proposals yesterday. What do they have to say?
That they hear the criticisms loud and clear, and that they are carefully listening to those Republicans who are concerned that repealing Obamacare without a replacement could prove to have political implications in 2018. I asked this question to Trump's senior advisor, Kellyanne Conway. Take a listen to what she had to say.
If we can talk to private industry, if he can bring along the public sector, meaning other Republicans in the House and Senate, other Democrats and independents if they like to come along, it's a healthy conversation to have. We hear from people daily, as I'm sure journalists at Bloomberg do, that they feel crushed by the cost, just the cost of the drugs that they need. So we should at least have that conversation. Donald Trump's the right person to lead it.
And I can tell you that last night on Capitol Hill, Secretary of Treasury nominee Steven Mnuchin has been making the rounds, meeting with lawmakers. So a lot of conversations happening here on the Hill.
Anna, Edney, I want to bring you in now. Drug stocks got hit, biotech shares as well on the news during the press conference, in fact. What are drug executives saying so far?
Well, it certainly took drug executives and the entire pharma industry by surprise, as far as we could tell. And, you know, the stocks went down as, you know, Trump was speaking about this idea of letting the government bid on pharmaceuticals. So there was a little bit of complacency, possibly, that, you know, health reform, repeal and replace of Obamacare was the focus for the Trump administration, but he came out yesterday, made these big remarks, and now pharmaceutical executives are going to have to deal with that. And I think they are certainly having those conversations, given that this wasn't something they were expecting to come up like this.
Anna, have we had any public comments from any of them yet? Because we still don't know what this bidding process would look like, whether it would be generics bidding against brand names, or how that would all work.
Right. There's no details on how the bidding process would work, but you know, there were some executives yesterday at the a JP Morgan healthcare conference out in San Francisco while Trump was speaking, and a lot of them took a measured approach. They weren't exactly sure that, you know, this is something that was 100% going to happen, you know, just kind of given how we've seen Trump's discussions going in the past. And so they just sort of said, it kind of sounded like a wait and see approach. They know that something is likely going to change, that this issue isn't going away. The American public wants something done, but they're not sure what the details will look like yet, and will want to be part of the process to try and work this out.
And coming back to details, Kevin, I mean, just give us an idea if and when the Obamacare bill is repealed. I mean, what will ultimately take its place?
Two things. First and foremost, this could come as soon as hours of Trump getting sworn in on January 20th, the repeal. But the second part, the replacement, that's where things are a little bit more unknown. And so I think Republicans would like to have this relatively wrapped up by the end of January, or at least within the first 100 days. But again, there's an intense debate going on right now between conservatives, with people like Senator Rand Paul, who I spoke with earlier this week, saying that he believes there should be a replacement immediately, and others advocating for a longer approach to implement. Yesterday at the press conference, Trump said relatively quickly, but again, the details of this plan have not been released yet, and that's raising a lot of uneasiness for Republicans who are up for re-election in 2018.
Yeah.